So, all right. As always, I'm recording this. I will upload it to YouTube later today or tomorrow. And I will, I created a new document that I'll add in the reconstitution question. So that way you can see it. Also, as always, if you don't know this already, if you have a question, just type it into the chat. If you need to stop me while I'm explaining something, just go ahead and unmute, and we'll go from there. And of course, if I'm meeting with you guys today at noon, and then I think again for 1:30 later this afternoon. I don't have that in front of me to say when that is. I think it's 3:30. That sounds right. And then also on Thursday. So if your questions don't get answered today, just remember there's going to be a couple reviews here. And so we'll knock those out. So I'm going to, if you go into the OneDrive folder, you will see the 23 fall update. So you'll see that there. I'm going to go ahead and pull that up. And as it stands now, it's the same one that's listed under there as 16 fall. But just letting you know that it's there. Okay. So let me go, like I said, to the IV flow rate questions, just because those are new. And then we can always go back to some of these other questions if you feel like you need to see them again. All right. So before I do 16, which is a flow rate question, but dealing with drop factor, let's do just some basic flow rate type questions. All right. So there should be plenty of room here. Okay. So a couple things to denote. So I'm going to start off with this number 19. So believe it or not, this question here is one of the more simple questions you'll get, but it's also one of the ones that's most commonly missed because you're thinking there's more to do, or I should say not you specifically, but nursing students are thinking there must be more to do. Okay. So let's talk about a couple things. So the first thing is, what is flow rate? When I talk about flow rate just means how much volume is being dispensed over a period of time. Usually that period of time, or that volume that we're talking about, is milliliters, and the time that we're referring to is hours. Okay. So a typical flow rate will be milliliters per hour. Okay. And so if I always say it's very similar to how you would think about like driving a vehicle. Okay. What is your speed? Your speed, or your rate in which you're traveling, right, is going to be miles per hour. But we're not talking about miles. We're talking about milliliters, and we're still talking about per hour. So now, so that's one type of flow rate. The other type of flow rate that you'll calculate is called a drop rate, where you'll actually utilize drop factor, and you'll get a drop rate that's specific in drops per minute. And we'll talk about that after we go through a couple examples of just general flow rate. So for this one here, it says the patient is to receive 375 milliliters of RL, which stands for Ringer's lactate, over 3 hours. What would you set the rate on the infusion pump to in milliliters per hour? So what you're going to do is you're going to take your volume, 375 milliliters, over time, 3 hours. Then you might be wondering, well, what do I multiply by? We don't multiply by anything. You just reduce it. So 375 divided by 3, and you're going to get 125 milliliters per hour. So what do you program into the infusion pump? 125 milliliters per hour. You're just reducing volume over time. That's all that is. Okay. All right. What about, let's see here. Let's look at another one. Now, when it's volume over time and it's milliliters over hours, there's no extra conversion that needs to be done. But sometimes you'll see something that will have minutes listed instead of hours, like this number 17, where it says a patient must receive a tube feeding of Ensure 120 milliliters in 90 minutes. What is the flow rate in milliliters per hour? So a lot of students will quickly take 90 minutes and then they'll just convert that just either in their head or however they do it to 1.5 hours, because you know that 90 minutes is 1.5 hours. You know that. And if you're using that, perfect. It's a great strategy. But let's say it was 40 minutes, right? And you don't know the decimal of 40 minutes it relative to, like, 90 minutes is 1.5 hours or 30 minutes is half an hour. You may not know what 40 minutes is off the top of your head. And so I'll show you how to do that here in just a minute. But first, let's say, or the way I would set this up just um, as a strategy and something to practice, just in case you see it, is take the volume in milliliters, divide it by the time in minutes this time, because that's what they give you. Then you're going to convert minutes to hours. The reason I like doing this as a way to show you is just that way we can see that we're eliminating things. In my head, I just do this in my head, okay? But I can't show you what's in my head. I have to write it out. So if you don't like dimensional analysis, don't worry, you're not alone. But I do find that this is helpful when we're doing these things. So all you're going to do is take 120 times 60 divided by 90, and you're going to get 80 milliliters per hour. If you did 120 divided by 1.5, guess what? You're going to get the same answer, 80 milliliters per hour. Now, while I'm working through these, because someone's already starting to put them in, if you get your answer and you want to put it in down there just for verification, just go ahead and put it. And if you're like, I'm not 100% certain, send it as a DM. I won't call you out and say, oh, so-and-so, you got it wrong. Like we'll keep it anonymous, just so you know you have that flexibility. Okay. It's one of the reasons why you do it this way instead of trying to do it on, like, YouTube Live or something like that, where everyone's seeing it, including people that aren't in the program. All right. So let me give you another scenario that's very similar to this. So I'm going to give you the same question, but we're going to do it and we're going to change the numbers here. So let's say this time it's 160 milliliters and it's 40 minutes. Okay. You may get a little bit tripped up on how to do that. But before I give you any kind of answer, go ahead and see if you can solve that. Just type into the chat once you get an answer. And like I said, you can send it as a direct message where only I will see it, and see if we get the same answer. So I'm going to do my calculation right now, and I'm not going to tell you what I get. And then I'll show you how I would set it up if you're sitting there going like, well, how do I set it up? Let's see here. All right, so I'm seeing the answers coming through. And if you got 240 milliliters per hour, that's what I got. If you didn't get that, or you just are still feeling stuck, I'm going to tell you to do the same thing that I drew up in the previous problem. Take the volume over the time that they give you, and then convert the time in minutes to hours. When you do that, you will get 240 milliliters per hour. That's supposed to be a 40. I know that looks like a 90, so let me see if I can correct that. Let me. Okay, 240 milliliters per hour. All right, so that'll also be helpful because if you get like 45 minutes, 50 minutes, things like that, you'll have some idea of how to solve that without. Now, the other thing I used to get as a question is people would ask me like, well, how am I going to give them 240 milliliters per hour if 160 milliliters will be gone in 40 minutes? And it's like, well, yeah, it's the same thing as like, if I want to get somewhere faster, I increase my speed, right? So I can cover a faster distance by creating an increased fusion pump. Now you might also be thinking 160 milliliters in 40 minutes. How slow is this person consuming liquid? So it's actually kind of slow, but obviously there's probably reasons for that. So we don't need to get into all the details there. All right, so those are flow rate. Another type of flow rate question you might see is it might kind of flip the script a little bit, and it'll give you a total IV, and then it'll tell you to calculate how long it's going to take for that to infuse. So this, you will do some math. So like number 19, it says the new 19, sodium chloride, 500 milliliter IV. It's infusing at 125 milliliters per hour. We want to know when is it going to run out, okay? So you could do this a couple different ways. If I'm doing this the universally loathed way, dimensional analysis, and then I'll show you how to do this doing order over half. But if I'm doing it this way, I'm going to take my 500 milliliters. And what I'm trying to do is I'm trying to get rid of milliliters and be left with time. The time that we have listed here is hour. Okay. So I'm going to invert my conversion of 125 milliliters per hour. I'm going to put the 125 on the bottom, hour on the top. So it's the same thing as saying order over half. And when I calculate that, I'm going to get 4 hours. If you're doing this ordered over half, this will work. It's just that sometimes it's just the wording doesn't quite make sense. You just got to remember that your quantity here is time, not volume. That's where things get a little bit different. So if you're wondering like, oh, I solved this a little bit differently, you and I are both doing the same thing. It's just that the way we're setting it up, or the way I'm at least representing it, is just a little bit differently. Okay. Let me just see if there's anything else here. Okay, we're good. All right. The next thing is to talk about drop factors. So when we talk about drop rate is just a type of flow rate, but instead of it being measured in milliliters per hour, it's going to be measured in drops per minute. Drops are abbreviated GTT and then per minute. Okay. And you might be wondering, why are drops GTT? Why can't they just be something simple like DR? Well, DR are drums. And I mentioned this earlier today, is that if you have perfume sitting in your house or sitting somewhere, if you look at it, a lot of times they're measured in drums. It's an apothecary unit. It's not a unit that we utilize in medication anymore. So that's why it's not utilized, but it's still a unit of measure for liquids, drums. So now you know. All right. So for this question, in order to calculate this type of flow rate, I need two pieces of information. I need to know the flow rate, which is usually which is usually milliliters per hour, but it could be milliliters per minute. Just depends on how it's written out. Okay. Then I need the drop factor, which is always going to be given to you, and it's always going to be in the units drops per milliliter. The combination of flow rate and drop factor, sometimes called tubing factor, is going to give us a drop rate, which is drops per minute. So flow rate is volume over time. Drop factor is basically how many drops equal 1 milliliter in a particular tubing type. And then we're going to get a drop rate. So sometimes you'll get a picture of a label, like this one says 15 drops per ml. Sometimes it'll just be written in the context of the question. It just depends on what we're seeing. So let's answer this question. If you have already worked through this and you want to go ahead and put the answer down, go ahead. If you want to wait, and I'll show you how I do this, then you can look at the next example when I give you one. So I'm going to take the order, or the flow rate is 75 milliliters, 25 minutes. You might be tempted to convert minutes to hours, especially since we just went over that and I showed you that. Don't do that. Don't convert minutes to hours. And the reason being is because we're looking for drops per minute and we don't need to make an extra conversion. Okay. So I have 75 milliliters, 25 minutes. I'm going to multiply by my drop factor, which is 15 drops per milliliter. And if you're ever wondering, did I set it up right? That's why dimensional analysis is so helpful, because now I can see the only thing remaining are drops and time, minute. So I know I did this right. Do my math, 75 times 15, divide by 25, and I should get 45 drops per minute. Good. And I'm seeing that that's what some of you are getting as well. Hopefully not just because you looked at the key. So to rule out the key approach, let me give you another example. All right. So we're going to use the tubing package, or I'm just going to put in a new drop factor. So we'll just say the drop factor is 20. You're ordered to administer dextrose 5% water IV solution at a rate of, let's do 125. Whoa, hello. Let's say 125 milliliters. Let's just do in 2 hours. Actually, let's make this even more interesting. All right. All right. So I'm going to add some complexity to this, because I want you to see what one looks like if it needs to be rounded. I'm not 100% sure if this needs to be rounded or not, but we're going to see. So, all right. So first of all, before I do anything, if you haven't done so already, go ahead and start trying to solve this particular question. And then once you get it, go ahead and put your answer into the chat. Again, direct message if you're not certain. But I've changed all the factors. I've given you a different drop factor. I've given you a different flow rate. But if you follow the equation of flow rate times drop factor, you will get to the answer that you're looking for. So we'll see. Now, I will tell you, some of you starting to write your answers, remember, I cannot give somebody a partial drop. So this is an example where you wouldn't round to the nearest tenth. Okay. You would need to make sure you account and round to the nearest whole drop. Okay. So as answers are coming in, and I'm really grateful that you're trying this question. And then I'm going to go ahead and write out. So I'm going to do this two ways. I'm going to do it a long way, and I'm going to do it a shorter way. But both ways kind of take some time. So I'm going to take my flow rate, which is the 375 milliliters, 2 hours. I'm going to multiply by my drop factor, which is the 20. Now, before I move forward, right now I'm in drops per hour, and this is a common mistake. So if any of you got like 200 something or 125, that's where you made your mistake. You were still in drops per hour. You need to be in drops per minute. So the other thing you have to do is you have to get rid of hours and convert it to minutes. Okay. So you have to divide by 60 as well. When you do all that, you should get 62.5. And because this is drops, you have to round that to the nearest whole drop. So it'd be 63 drops per minute. Now, you might be saying like, oh, I work where they do drops and things like that. You can't program it. It's either 60 or 65. That is probably correct. Okay. But in the CCAC math bubble, we're just trying to be as specific as we can given the scenario that's given. So if you were doing this and you got an answer of 63 drops per minute, you're sitting in you're sitting in the hospital room or in the patient care room, and you are, you have to choose between 60 and 65. I'm sure there's a protocol that you follow to kind of do that. So just don't think too deeply into that. We're just trying to focus on math, basically. All right, so let me just double check. All right, so most of you got 63. A few of you got 125, and I think we already mentioned why you were in the 125. You were in drops per hour, and I'm not sure where 21 came from, but just double check. Hopefully now you're seeing my math, and you can see how I got to 63. So I told you I'd show you a shorter way as well. So what is 2 hours in minutes? 2 hours in minutes is 120 minutes. So the other way you could have done this is taken your 375 milliliters over 120 minutes and then just multiply by your drop factor. Now, you can't always do this easily, because sometimes it'll tell you like 1 hour and 35 minutes or something like that. So you might need to do some converting and things like that. So sometimes it just makes sense to do the minutes or converting, just dividing by 60 once you get to that point. But this is just an alternative way. So when you do this, you're already in drops per minute, and you're going to get the same thing, rounded 63 drops per minute. All right, let me see here. Oh, okay. Thank you for clarifying. So somebody told me they used 125 milliliters per 2 hours and got 21 milliliters or drops per minute, which is what happened there. That's fine. Yeah. So I apologize. I did change it to 375. So, but now you know how to do it for 125 as well. So this gives you the same scenario. All right. So you should already have an answer for this one, number 22. It's basically the same thing. You have 1440 cc's, which, remember, that's the same thing as 1440 milliliters over 12 hours. And then what is the flow rate if the drop factor is 10? So you guys are showing me that you can answer these really well. So if I'm doing this as a reminder, I'm going to take my 1440. And then, like I said, I like to simplify. So I'm going to take that 12 hours and I'm going to multiply it by 60. And I think that's going to give me 720 minutes. Yeah. Okay. Oops. It's like when I hit that button. Sorry. I know it looked like I was playing around, but I wasn't intentionally trying to do that. All right, there's a button that I press on my pen here, and I never know when it's going to do that. So 720 minutes times my 10 drops per milliliter, and I'm going to get 20 drops per minute. Yeah. All right. So those are your flow rate type questions that you'll see associated with your test. Now let me show you. And then if you're ever looking for other examples of that, I would just say, if you just do a Google search for, nursing flow rate questions, it should give you plenty of examples, some of which are probably not going to be utilized or you're not going to see, but at least you'll be able to look at them. So let me pull up. I have another practice question that I'm going to give you that has to deal with, it's a reconstitution type question. Just give me 1 second. That way you can see it and know what a question that's considered reconstitution might look like. I don't anticipate you seeing this type of question anytime soon, but I figured I might as well show it to you. That way, if you do have a question that shows up and you're like, what is this? All right. So this is a reconstitution question. The current reconstitution questions you have are listed like this, where order requires 60 milligrams. You're going to choose the strongest concentration. There's a Pfizer pen question, and I'll give you some examples of that as well. But you might start seeing this, so I wanted to show it to you so that way you're aware of what it is and then how to navigate it. So first of all, what a reconstitution question is first of all, what's a reconstituted medication? Just means that in the pharmacy, it's available as a powder. You're going to add water to it and becomes activated, and then it needs to be utilized, usually in a short period of time because it has a short shelf or has a short half-life. That may not be true for all types of things, but for these, especially because they're injectables, that's probably the case. But you've dealt with reconstitutions before. It's the same thing that you're talking about when somebody, if you have kids, or if you remember as a kid, you got like the pink antibiotic. It's usually amoxicillin. It's got that, like, kind of supposed to have like a sweet flavor to it, and kind of milky and chalky. But that is when in the pharmacy, it's a powder. Then they add water to it, they shake it up, they give it to you, and they tell you to keep it refrigerated and then to administer it based off of what it says on the label. So that's an example of a reconstitution. You're going to treat it exactly like that. It's an oral based medication, or it's a liquid medication that's going to be administered in milliliters. So a typical question would be, it'll give you like the order. So let me just show you like what you'd probably see on a test. You're going to get an order and you're available. And then it'll ask a question like, how many milliliters will you administer? Okay. So it'll typically include those three things. This is just, this was grabbed from another image. Where it came from, I'm not entirely certain, but it's a good example. Now, typically, when we do oral-based medications or liquid-based medications, it'll tell you, I'm going to scroll up to an example here. There's a Dilantin question. That's a good example. So Dilantin is an oral-based medication. It's a liquid medication, and it'll tell you that it's available at 125 milligrams per 5 ml. So it tells you like right there on the label, 125 milligrams per 5 ml. For something like mepridine, right? Or meperidine, or whatever it's called, mepridine, it's available at 50 milligrams per milliliter. It's a liquid medication. Same thing for heparin, 10,000 units per milliliter. For morphine, 15 milligrams per milliliter. So I'm just giving you some examples. So when we go back to that reconstitution question, it says, and you can see it clearly written on the label, 500 milligrams. Where's the milliliters? You don't see it on the front part of the label. So it's important to know how to navigate that and how to get some answers to figure out where that is, because these types of medications exist and you need to know how to find the actual milligrams per milliliter in order to calculate the medication. Now, at first glance, you might be thinking, oh, well, it's 500 milligrams. It probably just means per capsule. It doesn't. It actually, I believe it means 500 milligrams per vial, and you need to know how much is in a vial. So that's one thing. You don't want to make that assumption that 500 milligrams is what that pertains to. It's hard to kind of isolate that. But one of the things that's like a clue in, first of all, it tells you how many milliliters will you administer, but also intramuscular, right? Intramuscular tells you it's a liquid and it's an injectable. Okay. So we're not going to be looking for capsules or tablets, but you might be sitting there going like, well, what am I looking for then? So a couple things, and this is going to actually help you out for third semester, what I'm about to tell you. The first, when you have a question that might show up like this, and you're doing a reconstitution, you have to look at the side label. So this is a little bit different, right? Because you haven't had to look at the side labels before. You're going to look at the side label and you're going to have to do some information gathering. So the first one, and like I said, this is going to be helpful for later on, particularly in pediatric dosages. It says the usual adult dosage is 250 milligrams to 1 gram every 6 to 8 hours. So what is my order? My order is 0.375 grams, which is 375 milligrams every 6 hours. So we can look at that and say, okay, it's within the usual adult dosage range. When you're dealing with kids, sometimes the order is messed up, and as a nurse, you might be on the front line to say, hey, that's too high or that's too low, and that might be of concern. And so that's why it's important to know when they put that on the label, the usual range or the safe dose range. Okay. The next step is it tells you for intramuscular, which is what we're doing, administration, you're going to add 2 milliliters of sterile water for the injection. Then you're going to shake well. You're going to withdraw the entire contents, and that's going to give you an approximate volume of 2.2 milliliters, which is the total volume. So there's a couple things here that are helpful, but not necessarily helpful for math purposes. So 2 milliliters is what you're adding to the powder. The total volume is important to know, but what's most important is what's in parentheses right next to the total volume. Do you see where it says 225 milligrams per milliliter? That 225 milligrams per milliliter is what you're looking for. That is the strength or the concentration or you're available to calculate the medication here. So now we have that information. Now we can at least see where it is. And the other reason I'm showing you this too is you might see this on ATI, you might see this on an NCLEX, or you might see this third or fourth semester. I don't think you're going to see it this semester, but it's a good one to see and to practice. It always takes me longer to explain these things because the common problem with these questions is you don't know where to find the information. That's why I'm trying to show you where to find the information. So the rest of this then is just what you've done before. And then I'll hopefully make some of you happy. I'm going to do ordered over half. I'm going to take my 375 milligrams over my available, the 225 milligrams. times my quantity. And then you should get so 375 divided by 225. You're going to get 1.6666666. So you're going to round that to 1.7 milliliters. Yeah, so just keep in mind when you're rounding, you want to make sure that you round appropriately. That's the thing that's always the tricky part with all this is making sure you're rounding. Now, I didn't answer all the questions just because this was like a textbook, just kind of showing you how to navigate. I'm trying to just answer the question how you might see that because I haven't had a chance to actually make a question that's similar to this. Okay. The other reconstitution questions that you've seen, I think you saw them last semester, are going to look something like this. They're pretty straightforward now after seeing what I just showed you, which is a truer reconstitution question. The question I usually get asked is, well, what, there's 3 strengths here. What do I choose? That's why you got to read, right? It says choose the strongest concentration. So which one's strongest? 20. For this one tells you to use also the strongest concentration. The problem that usually trips up most students is they try and figure out what to do with that milliliters diluent added. Remember, that's that same thing as that 2 milliliters that was added. I don't care about the milliliters diluent added. I care about the total volume. And so this doesn't tell me anything to solve the equation, which is why we can ignore this part of the label. And we just look for what is the strongest concentration. 1 million units per milliliter would be the strongest concentration. All right, so I rambled on for quite a bit. I showed you the IV flow rates, which is going to be, like I said, the newer thing. Is there anything that you wanted to see or look or work through here in the next 20 minutes? And so we can see if there's any other answer or questions I can answer.
Question. Are the same conversions we needed to know for 110 the same here, or
Yes.
did we add some? Oh,
Yeah, no, it's all the same conversions. And if you look at the beginning um, of each of the practice sets, and if you even look at you'll see that we have listed out. You need to know milligrams, micrograms, grams, all those things, and then teaspoons, tablespoons, ounces. You still need to know all those things. Yes. All right. So I actually get this question a lot. So someone asked, "Am I going over the same questions?" Uh, Ultimately, it just depends. So I'll probably will go over the IV questions again. Um, I might give different examples, but ultimately, if other people chime in with different questions, then that's what makes it different. But if you can't come on to any of the other reviews, I'm going to upload them all to YouTube. So if somebody asks something different, you'll be able to see that. Um, and then someone also asked, should you watch the old YouTube videos? Yeah, because a lot of it is just it's me doing the same things, but sometimes you might come up across a question that you're like, oh, what is he saying here? Or I missed something out, like or missed on something. That's a good thing. You can always come back in here and ask me, obviously live, or you can email me if you have a question. You can even ask questions in the comments on the YouTube for those things. I get notifications and then I can try and figure out. Just be specific with your question. Don't just say like, what do you mean by 5 milligrams? I won't know what you're talking about. And I'm not going to go through all 40 minutes of video to find it. All right. Hold on a second. where we have this one with the label. Yeah, so with the first reconstitution question that I went over, I don't anticipate that you'll have that on your first test, but it might. They're going to try and interject it because it's what they utilize at the other campuses. So I wanted to at least show it to you guys so you can see what it would look like. And yeah, I know it's confusion, which is why I went over it just so you can review it. And then if you go on to the YouTube channel, I've even done just a video on the reconstitution. I think there's even other examples, so you can look at those and get a better idea. And really, it's just like anything else. It's a new label. As soon as you start looking at the labels, it'll start to make sense because you're like, okay, for this type of med label, I need to look at the directions to look for the concentration or the strength that is being questioned. So. Oh, hold on. Yeah, you can practice the 110 and the 130. Remember, the 110 doesn't have the flow rates associated with it, and most of 110 is going to be repeated on the 130. But yeah, just take them as if you're taking them brand new. It'll be good practice. Yeah, you can even, if you want to, you can take a 220, 230 practice test. Just don't worry about the heparin protocol question. Yeah, the reconstitution question, like I said, is potentially going to be for the future. Milligram to kilogram conversion with pounds. Yeah, I think that's the last question, so I can work on that. When we answer the question, should be in specific form. I don't know what question you're referring to. I don't know if you. I don't know if it's Blackboard or paper. I have no idea. Loading. Yeah, I'm gonna do the loading dose question. All right, 23 and 21. Dilantin loading. Yeah, milligrams, kilograms. Okay. All right, so let's jump down there to those questions. So let's do these. Let's do what is now 26 and 27 because the numbering has changed. So sorry about that, but let me do this. So this is an example of a two-step problem because you have to account for the patient's weight, and then you have to convert the patient's weight in pounds to kilograms, and then find out what the milligram loading dose is. So for this question, it says, how many milligrams of anticonvulsant would you administer to a patient who weighs 176 pounds? And we're talking about for the loading dose. Okay. So what is the loading dose? The loading dose is 15 milligrams per kilogram. So we need to account for that kilograms. So we need to look at the patient's weight in pounds. So this is an example of a two-step problem. We're going to take the patient's weight in pounds, the 176, divide it by 2.2. I think that's going to give me 80, but let me just double check. Yeah, 80. So that's going to give me 80 kilograms for the patient's body weight. Then I'm going to convert and I'm going to multiply the patient's weight by the loading dose, which is 15 milligrams per kilogram. We can eliminate kilograms, and then 80 times 15 gives me 1,200 milligrams as my loading dose for the Dilantin for this patient that weighs 176 pounds. So what would change? The patient's weight, right? Or maybe the loading dose procedure might change as well. So you might be saying, well, what about the 300 milligrams per day? Well, it didn't ask about that. It asked for the loading dose, and the loading dose is 15 milligrams per kilogram. Yep. Yeah. So those of you wondering if it's paper or blackboard, yeah, orientation would be, that question should get answered for you. Just know that your test is next week when I think, yeah, next week when classes start. Your first lab is they're going to knock this test out of the way, and then you'll move on to other topics. So it's not like 110. I always forget to mention that to you. 110, obviously you had all, half the semester to kind of prepare for it. They're expecting that you're ready to rock and roll going in day one. So I don't think anyone asked me this one, but I'll just go ahead and do this one too. The micrograms to milliliters, basically. So this is another example. I don't know that you're going to see a question like this, but it's considered a two-step problem where you're just doing some conversions. So you have a couple pieces of information here. So the order is 500 micrograms. Your available is 0.05 milligrams per milliliter. And then they're asking you how many milliliters to administer per dose. Problem is you have micrograms and you have milligrams, and you can't do math when there are two different units. You need to convert those units. You either need to convert milligrams to micrograms or micrograms to milligrams. It doesn't matter what you do as long as you do that conversion. So if you remember, and I'm just going to choose what's simpler for me, so I'm not changing too many variables, or at least thinking I might need to change too many variables. I'm going to convert the 500 micrograms to milligrams. So hopefully you remember, you can just move your decimal point 3 to the left. And so this would be the same thing as saying 0.5 milligrams. And now you can solve this like you would do any other type of medication. But the first step is doing a conversion. Just like in the previous question, the first step was converting pounds to kilograms. Here we're just converting micrograms to milligrams. So I'm going to take my order over my available times my quantity. And I'm going to get, I think it's just 10 milliliters. All right, so I think I talked about milligrams per kilogram. Oh yeah, let me go to I did the dilantin loading dose. That was the milligrams per kilogram. So 23 and 21, what question was that? Was it these two? Or is it up here? Because I changed these numbers up a little bit. So whoever asked 23 and 21, just message how those questions start, or if you don't mind unmuting and letting me know so I can review them. Okay. All right, so I think I went over everything that you guys asked me to. I hope I answered some of your questions. If there's a question that wasn't answered and you can't make it to any of the other review sessions, this is my email address if you don't already have it. You can email me and just say, hey, I'm having a hard time with this type of question. Just give me some feedback so I know what type of question you're looking for help on, and I'll see if I can help out with that. Like I said, I'm going to be back in here for 1:30 next Thursday, or on Thursday at the same time at noon. And then I know I'll also be here for this afternoon, and I'm looking for the time so I can let you know. I do think it's 3:30. I just can't remember off the top of my head. Oh, 345.
To 445. Yeah.
Okay. All right. Well, like I said, if you have any other questions, just let me know. Otherwise, I'll wish you good luck if I don't see you between now and then, or if I see you the next time, then I'll see you the next time.
Thank you.
Thank you.
Thank you.
Yep.
Thank you.
You.
You're welcome.